Hi, you've tuned in to Radio Northern Beaches, your Listen Local station, right here on the Northern Beaches of Sydney. You can find us on your radio dial at 88.7 and 90.3 FM. Can't get to a radio? No worries. You can always stream our program live from anywhere in the world at rnb.org.au. And for listening on your own schedule, our podcasts are available globally at rnbpodcast.com.au. So be sure to follow and subscribe so you don't miss any episodes. Now, here is our latest podcast.
Hello again, listeners to Community Radio Northern Beaches, 88.7 and 90.3 FM. We're streaming live on our website, www.rnb.org.au. Our program is Community Voices, and I'm Michael Lester. We seem to be going through yet another crisis in social services delivery here in Australia, particularly now in the childcare sector, and following a whole series of what have been described as sickening and horrifying and shocking allegations of abuse in childcare centres and the childcare sector. The government has rushed through into Parliament with some important legislation characterised as sweeping reforms to the childcare system, which they're pushing through the system. I guess this all gives rise to the question of how we got to this position, what are the symptoms of this, and how might we move beyond this, and will the legislation and the approaches that we're adopting get us where we need to go? To discuss this, our guest today, John Quiggin, Professor of Economics at Queensland University. John in particular recently, and for some time now, has written a number of articles and critiques of our social services delivery systems, and most recently in the childcare area, which he characterises as the latest failure of Australia's privatisation push, and he calls for a complete rethink and overhaul of the ideology, not just the operation of the system. Thanks for joining us, John.
Glad to be here.
Yeah, well, John, I guess the immediate question is, this sort of legislation that the government is putting through, particularly tackling the question of the fact that the childcare sector and the fastest growing sectors and predominantly services are delivered these days through private services. I think taxpayers put some $16 billion and nearly 70% of the running costs. It's a real growth area for private sector operations. To what extent is the sort of approach the government's adopting now going to tackle the real problems here?
Well, I think that fundamental problem is not going to be addressed. So, of course, it's important to recognise that these kinds of problems of abuse happen throughout the care sector, but they're made worse by the incentives of for-profit ownership, and this really has been the core of the failure across large parts of the social sector. Allowing for-profit enterprises into the sector invariably means that they're going to deliver the lowest common denominator in terms of complying with the regulations. They'll comply with them to the minimal extent to which they can do without facing either penalties from the state, or becoming so obviously substandard that their clients don't use them. And of course, that's much more difficult in cases like childcare, aged care, and so forth, where the clients often don't have the capacity to say, well, this is going very badly. They have to rely on parents, children, and so forth to pick this up. We've just seen this across a whole range of areas where privatisation has taken place.
Yeah, well, indeed. It does seem that we go through what I think you've possibly described as a cycle in these social care areas in recent times, where we get great booms in private provision, whether it's in education or health or childcare in this sense, big investments off the back of big public subsidies. But then we get exposés and inquiries and royal commissions and shocks and horrors about the fact that things aren't up to the standards that we expect and that we think we're paying for. But then we get inquiries and recommendations, and the approach generally seems to be to say, well, let's tighten up the regulations here. And That's what the government's proposing to do here, isn't it? It's even threatening to cut funding and shut down places that don't meet standards. Is this a productive way to handle responses to these crises and childcare in particular?
Well, I think I'd step back at the first issue I really came across this with which was vocational education. So we had a big push towards for-profit vocational education starting in Victoria around about 2008, I guess, and extending federally. And what we saw, of course, was they had a regulator who was supposed to make sure that abuse didn't happen, but inevitably they did. What we saw was that providers were rewarded for producing graduates. So they signed people up, said, take our course, we'll give you a laptop or something like that, and produced, in some cases, in some sense, the participants were in on the game. They just took the laptop and didn't worry. In other cases, people got qualifications, but they turned out to be worthless. So this is pretty much the same model we still have, and they just repeat it over and over again. So I looked at the Productivity Commission, which has been the big advocate of this kind of thing, but until 2010 or thereabouts, they were very keen on for-profit vocational education. Then they recognised, no, this was a problem, but they still say, what we need is regulation. And the answer really is, if you're trying to regulate a for-profit provider who is taking public money, you're really playing a losing game all along. They're going to have a lot of incentive to do what's needed to get a tick under the regulations while minimising their costs. Meanwhile, the regulators are invariably understaffed, and in many cases, if they're competent people, those people are hired away by the regulated sector.
Yeah, so what are the characteristics of these public-private partnership service operations in the areas we're talking about? And in childcare, the management that's put in place is what? Driven by profit and cost, I guess. But how is that manifest in the way they run these things? What decisions are they making that ultimately might lead to the sorts of problems that we're facing?
Well, childcare has been problematic for a long time, I guess. It was already emerging as an area of difficulty in the time of the global financial crisis. There was a guy named Eddie Groves who, among other things, owned the Brisbane basketball team, and they had this very complicated setup where the childcare centres rented their land from another company in the same group, and the whole structure was designed to extract the maximum profit, and crashed out, leaving people in the lurch. But they were just replaced by new operators using fairly similar models. So that's the sort of financial side of things. You come to the question, I guess, of how they handle problems of the kind we've seen, where somebody is accused of wrongdoing, child abuse and so forth. And of course, we have to, as I remember, that all bureaucracies have an incentive to cover these kinds of things up. Certainly in the 20th century, we saw this thing, particularly, I guess, in church schools, but also to some extent in the state school system. It was much easier to try and cover things up than to deal with them. But that's more or less formalised in the kind of responses that a for-profit provider is going to have. They're going to make sure that they comply with the regulations as far as they can be enforced, and no further.
One's tempted to want to see what are the underlying real structural problems that face and challenges that face this childcare sector. It's a booming sector in terms of both the demand and the supply side. To what extent is an underlying problem a lack of skilled and trained and shortage, and I believe significant lack and shortage of skilled and trained people, let alone the sort of wages they're paid? To what extent, if these issues were on the table, might the outcomes even in the public-private area be different?
Well, certainly I think we have across the sector, shortages of workers. That's in a sense globally a good thing. We have full employment in the economy for the first time in many decades, and that provides a problem across both the public and the private sector. I think what we have, particularly in the childcare and to some extent preschool sector, is an area of social responsibility which has become more and more urgent over a long period as women have participated in the workforce, one which governments traditionally haven't tackled and one which they've been unwilling to do. So they've relied on a combination of community provision and for-profit, and they've in that process been guided by an ideology of the Productivity Commission and others saying there's no fundamental difference between the two, and according to national competition policy principles, we shouldn't discriminate. Now that's led to for-profit providers becoming dominant, and that's had disastrous results. I don't think there's an easy way of tackling the staff shortage problem, but I think there's no doubt that the solutions that are going to be found by for-profit providers are going to compromise the quality of care.
Our guest on Community Voices Radio Northern Beaches Community Voices program is John Quiggin, Professor of Economics, Queensland University. We're talking about the current crisis and proposed reforms in the childcare sector. Obviously, the media too pick up on these stories very much, and in fact, a lot of the current heat and attention, not least around the legislation, has been through continuing revelations through the media, including the ABC, about these abuses and what have you. And the media obviously pounce on these stories and tell these stories. I wonder what the data and evidence base is for this. We hear about these particular cases and incidents and video scenes. What is the data and evidence about the extent, evidence, and impact and trends in these abuses, not least in the private providers versus, the community-based or public providers?
At this stage, as far as I can see, it's all anecdotal. We've had a series of cases, but not enough to really tell us very much about, in a statistical sense, about what's going on. So in a sense, we're just looking at the fact that most of the prominent cases appear to have been in the for-profit sector, and that the description of how they were dealt with confirms all the previous experience we have of the failure of for-profit provision of human services.
So there isn't really a strong evidence base, is there, necessarily, about the extent of these things beyond the stories that are breaking in the media, and certainly not to evidence that might support the proposition that these problems of abuse and what have you, any worse or otherwise, between the public and private sectors?
Well, I think as long as we approach this stuff on a case-by-case basis, that is on a sector-by-sector basis, we're going to continue with this pattern that we'll contract out the service, problems will emerge, there'll be a crackdown, in many cases with a return to more public involvement, and then we'll keep on making the same mistakes in other fields or just returning to it. But I really think after more or less 20 years of this stuff, it's time to just accept this is a general principle that we shouldn't be supporting for-profit firms with public money.
And child abuse, just on a broader theme, I mean, it's perhaps even more broadly a social problem, not just in the childcare sector, isn't it? I mean, we've seen it exposed in other sectors, but in particular to the important role of what happens in the home and the home environment, and what attention, if any, there relatively is drawn towards the incidents and otherwise and causes of child abuse, physical and sexual.
Undoubtedly so. I mean, that's really outside my area of expertise. I basically have looked at the provision of services outside the home of various kinds. But I think it's a mistake to just say, well, look, if we certainly it's a mistake to say if we tighten up regulations, these problems will go away. And there's no doubt that these kinds of issues are deep-seated. Again, statistically, it's unclear whether these problems are getting worse or not. And of course, lots of things which would now definitely be classified as child abuse were par for the course last century. Certainly, beating your kids with a stick, for example, was routine in schools when I was there, and presumably took place at home and no one did much about it.
Yeah, I mean, heavy-handed intervention on behalf of regulation and enforcement and penalties seems to be one of the standard responses, and that's sort of reflected a bit in the current legislative approach. And whether you might characterize that as genuine reform is an interesting question, isn't it? Because what's the evidence that more heavy-handed regulation, and how's it going to work anyway? I can't help but think too about the way in which we had the Royal Commission on children up in the Northern Territory and the very heavy-handed responses and interventions by the federal government, which in retrospect clearly haven't had much positive impact in the long term, have they?
Well, certainly, I think I certainly think the natural response to immediate-driven problems is this kind of intervention, which typically doesn't address structural problems. So some of those problems are just are very difficult to handle. I mean, you look at the problems of the Northern Territory, and you have long-standing multi-generational poverty and these kinds of things. There's no simple solution to these things, but I think in the human services sector, we do have one clear structural approach, which is simply to get for-profit businesses out of anywhere where they are relying primarily on public subsidies. I think we've seen this across so many sectors now that we ought to have learned our lesson, that to the extent that we have private provision, it should be 100% market supported, so that it's the customers who are paying the full price and who are responsible for ensuring they get adequate care. If that can't be done, I think we just need to get the for-profit businesses out of the field altogether.
That's a huge shift in policy, and one might wonder not only about politically how that might be put in place, but what might be the practical policy pathways towards that, given the huge investment, as I say, 16 billion, I believe, a year in the childcare subsidy to private providers, 70% of the running costs. How do you make a transition, do you think, policy-wise, towards moving away from this public-private system?
Well, of course, there's no public system in the strict sense. There's only community and for-profit, largely. So I think the answer has to that we extend the role of actual state provision. And one of the problems we've had in public policy is that we fixed the boundaries of that a long time ago. To take another example, I mean, we don't have dental and Medicare. Why? Purely historical reasons. That the dental profession is different, and so it's been too difficult for governments to organise. But in the end, I think we have to have governments taking a much more direct role in these things. We'll see, of course. We're dealing now with the problems of the NDIS, where governments have more or less taken responsibility for this sector, but where we're doubtless going to have more problems with for-profit provision there, I think.
I mean, given the heavy reliance on the private providers in this sector and in others too, the question of a transition, even if there's a political will to do that, it leaves the public sector in a pretty difficult situation, because we've seen it in aged care too, and in private sector hospitals too, here in the Northern Beaches. I mean, if these people go broke, if there's a heavy set of standards that impose costs, they can't run a business, they're going to shut them down. They're under no obligation to take account of the immediate effect on the community and what's going to happen. This is a very difficult situation to find a way out of, isn't it?
It absolutely is. I mean, I think we've seen the cycle starting to work its way through with vocational education, that our governments tried to get rid of TAFE, in essence, especially in New South Wales, replace it with for-profit providers. We're gradually seeing that kind of thing reversed. And of course, this is also true of privatisation more generally, that unscrambling that egg is certainly very difficult. But again, I think so there isn't, I think, an easy answer. And I think in the end, the likelihood is that more public money will have to be spent. I mean, a large part of the motivation here was the idea that somehow, through private sector efficiencies or whatever, we could meet an increasing set of demands on the government, ultimately to take responsibility for things like childcare, which it hadn't done in the past, without raising the share of national income the government's taken tax revenue. In the end, I think that's at the back of all this, and we will see what comes out of course, the great summit to be held next week. But in the end, the answer has to be that we need a larger share of national income to be paid in taxes and then spent on the provision of services.
I mean, this whole idea too that it would somehow save costs for the government and mean lower taxes, and in a sense, the private sector shows, and doesn't it in this sector too, that what we often find is what's called skimming of the cream. They'll provide those services to those clients at a cost that they can make a profit at and for people who can afford it, but you won't get equitable and good access to these services under this private regime, and you're still left, aren't you, with a rump and a core of a demand that has to be met otherwise?
Well, certainly that's, I'm not sure how big a deal that is in the specific case of childcare. I mean, hopefully they're not doing too much cream skimming there, but certainly that's been the case with employment services, with a whole range of activities. And that what we see is it's much cheaper, much easier to make money by identifying weaknesses in the pricing scheme, things that are paid, finding the things where the payment from the government is above the cost of provision and ignoring the others. That's much easier to do than to actually say, we're going to provide the same service the government would like, but do so more efficiently.
Well, I'm not sure how much joy we might take from this sort of perspective, because it does seem that the approach which is being adopted that we've discussed, including in the current legislation, is one very much on regulation tightening and what have you. Whether this can rebuild the trust that's necessary is a very open question, isn't it, given what you're saying?
Yes, I mean, I think it's just simply very difficult ultimately to trust the ultimate owners, with these large businesses. As somebody said 100 years ago, why expect anything from a corporation when it has neither a body to be kicked nor a soul to be damned? That's in essence, we've seen this again, of course, with private sector consultancies. A bunch of them have been banned, I guess, because of bad behaviour. And we keep on making the same mistakes, I think. I mean, I think unless you have a very clearly well-defined service where the government knows what it's paying for and gets it, this kind of contracting out is just fraught with all kinds of difficulty. And there's no easy way, I think, to fix it. Ultimately, we have to bite the bullet and have public provision.
Well, one might also ask, in respect to the sort of system we've got at the moment with these private providers and private sources of finance involved taking profits, just how transparent anyway to the public these underlying issues are about the operation of these entities and the sources of finance, and then leads to the question of just what accountability anyway is really possible within a structure like this.
Well, indeed. I mean, in fact, I mean, except when things go badly wrong, as they've just done, a large part of the appeal of this kind of thing is the lack of accountability. So if you look at these deals, you'll find almost certainly that there are a whole bunch of contracts which are commercial in confidence, and that are things which, if they've been undertaken within the public sector, will be subject to freedom of information with all its limitations. And most of the time, this enables the relevant minister to get away with saying, sorry, I can't tell you anything. All we have is the limited reports provided by the regulator, perhaps, and everything else is commercial in confidence. And I think in some ways, in political terms, this is a false economy, that all the minor stuff is covered up and then something blows up and we have a crisis. But the instinct of all bureaucracies is secrecy, and commercial in confidence deals gives you that. under the guise of efficiency.
And I suppose in closing, a sort of underlying economic and policy question really in this whole space must be, to what extent is there a real rationale, and what is that rationale for significant public subsidy at all? In this case, in childcare, what is the underlying economic case for public intervention and subsidy?
Sure. Well, I suppose, you can look at this either from the point of view of a subsidy to the parents or a subsidy to the children. So the case for children, I think, is pretty strong that the children are there. It's highly unlikely, I work on this topic, highly unlikely that adding or removing these subsidies is going to make much difference to the number of children there are. And the alternative, if the subsidy isn't provided, in our current environment, is a mixture of less parents, presumably predominantly mothers in the workforce, and less adequate care. And so before there was a formal childcare sector, we had a whole bunch of informal arrangements which also weren't very satisfactory. So I think there's a pretty strong case. I don't buy the case particularly that it would lead people to have more children, but it's certainly in terms of gender equity, we know that in societies organised, if there's inadequate childcare, the burden of that will fall mainly on women. And if there's inadequate childcare, that will be bad for the children.
Yes, and the government's principal advisor over the decades in all of this, and of course there's an underlying political ideology that led to these sorts of reforms a few decades back. But the Productivity Commission, in its report with its economic view, it seems to articulate an economic case in terms of productivity, doesn't it? Which is its brief, but never really seems to question the nature of the public-private partnerships as a means of delivering what may or may not be a legitimate public subsidy for broad positive public interest externalities.
Well, it certainly, they would say, I think, that they have externality judgments, but if you look at their reports on human services, they simply completely duck the question of whether for-profit provision is adequate. They just say, we don't see any reason why it should be. They had an inquiry, I guess, 2015 or so, presented with heaps of evidence to suggest that for-profit provision was inadequate, and literally they answered with one sentence saying, we're not persuaded. So I think, as I say, in terms of public sector savings, in many respects, I could offer a big saving, which is I could write in advance the findings of any Productivity Commission report and save the work of hundreds of people preparing the report, because we know exactly what answer they're going to give.
Well, on that note, we'll wrap up here on Community Voices Radio Northern Beaches with our guest John Quiggin, Professor of Economics, Queensland University. We've been talking about the crisis and proposed current legislative reforms for childcare to try to rebuild trust in the face of recent horrific and shocking revelations about abuse in the sector. But John, as we say, it seems like a very deep-seated problem, and it does not seem that there's much appetite to tackle some of these deeper underlying questions in the form of public delivery, does there? So I guess we can look forward, notwithstanding any tightening of regulation, to further crises and issues over the period ahead.
I fear so.
Thanks very much, John Quiggin.
Thanks for having me.
Australia, the lucky country. We've got meat pies. We've got the world's best beer. But most importantly, top of the list, we've got Radio Northern Beaches 88.7, 90.3. Now hitting the entire world on www.rnb.org.au.